we are joined by State Senator Darrell Roussan, a Democrat who represents parts of Hillsborough and Pinellas counties, a regular here on our show, and also Johnny Crowder, the founder of Cope Notes. Johnny, welcome back to In Focus. Gentlemen, thank you for this conversation, one that I think will resonate with a lot of our viewers. And Senator Roussan, if I may begin with you, you have spoken for years about your own struggles and your ongoing recovery process. When we say mental health, that's such a broad topic. So what does supporting mental health mean to you?
Well, it's very personal, as you say. I am a recovering addict with 27 years, 5 months clean without a drink, a drug, or a smoke. But 17 years ago, when I got to the legislature, there was still huge stigma around mental health, around substance use disorders. But in the 17 years I've been there, I've been able to change the conversation to finding methods to help those who suffer from addiction, who suffer from co-occurring mental illness issues. And it's been exhilarating.
And, Johnny, again, welcome to the show. Another person, Johnny, we've talked to about mental health in the past is Commissioner Kathleen Peters from Pinellas County, and she had an interesting quote on her campaign website. It was saying, now more than ever, it's imperative that we reform access to care for mental illness and substance abuse and renew prevention efforts. So would you agree with that assessment and call to action, Johnny? What is the first step?
Yeah, it's really funny. That phrase, like the best time to plant a tree is 20 years ago and the second best time is now. I always think we always say now is the most important time to do it because we should have been doing this 20 years ago. And I do think a lot about access and that first step. If I look at my younger self, I didn't start therapy until I was 16 years old. I needed help way before then, but the first step of therapy felt so huge to me. It felt like I had to climb a whole story, like I had to climb 12 steps instead of one step. So I think a lot about what the senator brought up is the gaps in the continuum of care. There's the pre-care people, who was me for a long time. I didn't want to go to a therapist, didn't want to take medication. And then there's that intercare, between sessions, and then aftercare. I think that's where I really flunked out. So whenever people are talking about access and taking care of people who maybe aren't quite ready to make that step towards therapy or towards treatment or towards medication, I think for every one person who's booking a therapy appointment, there's probably 9 people who are saying, I don't need something like that. And the question becomes, what do we do for those people so that they don't face crisis?
Johnny, what was your demon then? And does it continue to nudge you from time to time?
Yeah, I think so. I really struggled with a lot of different mental health conditions that overlapped. So I really struggled with obsessive compulsive disorder. I was extremely depressed, very anxious. I was really struggling with bipolar disorder. I was hallucinating. I was struggling with self-harm. So it felt like there were a bunch of different things all overlapping. And I think even though now I'm living a very functional life, I remember thinking, I'll never have a girlfriend, or I'll never have a job, or I'll never have an apartment, stuff like that. Now I get to have all these things, but it's like the senator mentioned, I think on the previous segment that we did together, where he said something to the effect of, this is like an everyday effort for us. We work to be healthy. It's like you don't meet you don't meet Dwayne "The Rock" Johnson and he's like, oh yeah, I walked out of bed like this. He works out every day, he diets, and it's just like that for mental health. So I live a much healthier and more well-adjusted life than I did, but that's not by accident. It is by virtue of me purposely pursuing it.
Wow, tremendous hard work and an enormous discipline. And so, Senator, to bring you back in here, I'm sure you talk with some of your fellow state legislators about this a lot. How do the mental health issues that you see in your district from your constituents, how do they overlap with what other lawmakers see where they come from? Are there any differences?
But it's funny you should mention that, or providential, depending on how you look at it. But in 2017, 2018, I traveled the state and I visited 43 drug treatment facilities, halfway houses, sober homes, mental health centers. I sat on the bench with Judge Leifman as he adjudicated mental health court. And I went back to Tallahassee armed with knowledge. Knowledge is dangerous, armed with information. Information and knowledge, acknowledgement make a lot of sense. But right now I'm doing the same tour. I've been in Miami-Dade visiting Citrus Behavioral Health. I've been in Marion and Clay counties visiting their mental health centers. And I was in Duval yesterday visiting their behavioral health centers to see how far we've come and what is there left to do. There's so much work in this field, and the pandemic only exacerbated it. The need for treatment, the need to keep people out of isolation, the need to keep people in their jobs, in their normal routines.
And when these folks at these facilities, Senator, that you visit, when they see you come in, all buttoned up, suit and tie, and wow, that's our senator or a senator, depending on where they're from, are they surprised to hear your story or even inspired by it?
They're surprised, but they're also inspired. And in these areas, I've had the various senators and representatives of those locations, if they could, join me. Yesterday, Senator Clay Yarborough joined me in Duval, Jacksonville, to hear Northwest Health Behavioral Center talk about how they stand in the gap and get people treatment and give them post-treatment follow-up. So when I have conversations with my fellow senators, it's because I've been in their area. I've seen what's happening, and we want to make it better.
And Johnny, then from your perspective, whether it's in terms of shining a light on the issue or maybe getting the funds and allocating those or anything in between, what would you like to see come out of Tallahassee on the subject? We have Senator Rouson with us right here. What are you just begging to get for folks?
Yeah, I think we've done part of the work. So part of the work is sort of raising awareness and earmarking funds. So I hear a lot of people say, we've earmarked, $12 million for behavioral health services. And it's like, great. But sometimes that funding doesn't get deployed. So it's kind of like saying, I've earmarked $120 for a gym membership. And it's like, okay, well, if you don't buy the gym membership, it doesn't matter how much you earmarked for it. So I think when I look at I run a mental health company, when I look at other mental health CEOs who are also providing services to people, and I think about what's standing in their way, a lot of the times it's funding has been set aside for this, but it's not, there's some disconnect a lot of times between the actual earmarking of the funds and then it being given to the organizations that can do the work. And I'm speaking as someone who is not in politics and is talking to the organizations that we're trying to serve who are saying, I thought we had money for this, but either we haven't received it or we haven't been able to spend it. There's sometimes a blocker there. And I think that's the next big problem to solve is now that we've set aside the funding and raised the awareness, how do we actually deploy that funding in a way that gets care to the people who need it?
So, Johnny, I want to dig deeper here. Let's talk more about the kind of evolution of the issue. What new or evolving trends have you noticed in terms of mental health, say, over the last few years, and people using your company to help?
Yeah, two big shifts that I've seen. One is away from session and appointment based care. So I know that, if I rewind and look at myself when I was younger, I could always find a reason to skip a therapy appointment. I could be like, oh, that day I have too much homework, like when I was in high school, or actually that day it's my sister's cousin's boyfriend's birthday or something. So I could always find a reason not to attend. And I think a lot of people now, their schedules are less predictable and they're more interested in like self-guided resources. So that's one thing that I've seen is like, let's not set aside one whole hour every week or every month, but let's see if I can maybe do 5 minutes here, 5 minutes there. And while in a perfect world, everybody would have the time and the money and the schedule and the lowered self-stigma to engage with like consistent treatment for an hour at a time. A lot of people aren't in that boat. So I think making options available for them in bite-sized pieces becomes really important. And the other thing I've seen, the other big trend is there seems to be less of less, not none. There seems to be less of this mentality that, oh, mental health, that's for other people. Like a lot of times, if I'm speaking on stage somewhere, when I started speaking like 15 years ago, the mentality of the audience was like, a mental health talk. Like I wish my husband was here. He's the one who really needs to hear it. Or I wish my boss was here. And I think now there's less of that and more of this openness to, like, there are people watching this segment right now who are not living with a mental health diagnosis. They're just genuinely open to learning about this and learning about how to support their friends and family, how to take good care of their brain. So I think there's a greater degree of openness now than before. Like, I think when I started Coke Notes, a lot of people thought, oh, that's a resource for people who are really struggling and down and out. And I think, yeah, we serve some people like that. I spent a lot of my life in that boat, but we serve a lot of people who are just trying to take good care of their brain. And I like that trend towards prevention.
Yeah, I love that. So from these new trends then to new outlets addressing those trends to new legislation, Senator, you touched upon this. You sponsored legislation this spring that was signed into law back in June, which, among other things, it expands access to mental health and creates new training programs for behavioral health professionals. The bill also, perhaps, Senator, unexpectedly put you in the spotlight, because some members of the Florida House objected to a provision naming a new research center at the University of South Florida after you. So I first want to take a listen to how you reacted at that time.
The establishment of this center means a great deal to those who believe in advancing mental health care with evidence-based compassion. Unfortunately, the House didn't see it our way. And for me, it is more important that the work continue, that the work of the commission be honored, and therefore, I'd like to make a motion.
You're recognized for a motion, sir.
I move that the Senate concur in the House position.
And we should note several of your fellow state senators, now in different roles, took a stand on the floor in support of you. Listen.
Want to agree with you at all on this. We should turn this around, and we should tell them to get their heads straight.
It is a travesty that the other chamber didn't allow this to go through. I am angry beyond words. You have embodied almost everything that everyone in this chamber has aspired to be. A true statesman, somebody who has faced incredible odds to be where you are right now today in this moment. I don't think there's anybody in the process that has more respect for anyone than they have for you. And the fact that you care more about the policy than yourself and wanting to concur with the House's position says more about the integrity and the honor of you, sir, than anything that you have ever done in this legislature before. And I'm going to appeal to every single person in this chamber right now.
The bill eventually passed without the naming provision, but in June, at the bill signing, Governor DeSantis surprised you with this.
I'm pleased to announce that we have worked together with both the Florida Senate and the University of South Florida to officially name the Florida Mental Health Institute the Senator Darrell Roussan Center for Substance Abuse and Mental Health Research.
Senator, I am feeling the feels all over. Take me back to that moment of that recognition.
Well, it was a powerful moment. And it's really more important that the work of the commission be honored. And I'm not stuck on honoring me. I've done the work. I've built a body of work around mental health and substance abuse. And I need to thank my law firm, Rubenstein Law, for supporting me in this public service endeavor. And I need to thank the University of South Florida. Dean Sarovich has done a great job with the behavioral health of her department and her research. And I'm looking forward to this vote by the Board of Trustees on September 9th to solidify the center. It will do cutting-edge research when it comes to substance use disorder and mental health. And it will help a lot of people. That's what's important at the end of the day, helping people, not ourselves. We keep what we have by giving it away. Johnny, you know that.
And Johnny, then, you weigh in here. What kind of impact do you think it has, both in terms of pushing for action and making Floridians feel seen, to have elected officials or public figures acknowledge their own mental health struggles?
Yeah, I think even if I didn't know the senator's background, I would be like, wow, this guy's in recovery, isn't he? Because he actually cares. You can always tell people who are like walking the walk and doing the work because they just have like a genuine care for other people and the advancement of the conversation. I think for me, like as a young kid, what I needed to see is people in positions of relative power and influence and just like well-adjusted adults. I needed to see them living a happy, healthy, and well-adjusted life so that I could believe I could do the same. So I'm a firm believer in recovering out loud. And I think this is a step towards that. It's like, let's not shy away from, you can Google what diagnoses I have. And I like that. I like that. So I can't hide from it. I think the more that we associate, I think there's power in associating a name with a diagnosis, because now it's not, if people think about schizophrenia, it's like a big scary word to me when I was a teenager. Schizophrenia, I'm so scared. And then I meet someone with schizophrenia and I go, oh, well, that's Jamie. And it would like help me really personify it and take it out of a textbook or out of my nightmares or out of Hollywood, like someone in a straitjacket or in a padded room, and be like, no, I know that person. Like putting a face and a name to it, there's power in that. So I'm so glad that they decided to do that for you, Senator. It's not for you, I think, which is the coolest part. They're doing it to assign a name and a face to a movement, and that makes it feel more personal and more real.
And these folks as well that you're talking about, they're our neighbors. They are living next door to us. So I am so disappointed that we've run out of time already this week. Johnny Crowder and Senator Roussan, thank you.
Thanks for watching our YouTube channel. To keep up with important issues impacting our communities and hear more conversations with the people who are shaping the future, subscribe to our channel. You can also download our app or find Spectrum News on your TV for balanced, in-depth political coverage and more.